Good morning, everyone. My topic is the visual outcomes in the patients of gunshot injuries. The gunshot injuries to the eye represent a Gunshot injuries to the eye represent a significant cause of ocular trauma, often leading to devastating visual outcomes. This study aims to evaluate the visual outcomes and associated clinical findings in the patients with ocular trauma due to gunshot injuries over a 6-month follow-up period. The severity and the type of injury can vary widely, influenced by the factors such as the caliber of the firearm, the distance from which the shot was fired, and the anatomical location of the injury. The study aims to evaluate the visual outcomes and associated clinical findings in the patients with ocular trauma due to the gunshot injuries over a 6-month follow-up period. This was a prospective observational study which was conducted on 24 patients who sustained ocular trauma from gunshot injuries. The study included 24 eyes from 24 patients aged between 21 to 50 years with a predominance of males, that is 23 males and 1 female only. The injuries were classified as open globe or closed globe injuries based on the clinical examination. The 24, this is the same thing enumerated. We assessed on the, in the clinically, each patient underwent a comprehensive evaluation that included the measurement of visual acuity, swinging flashlight test to assess the relative afferent pupillary defect, slit lamp examination for anterior segment evaluation, the fundus imaging for the posterior segment assessment, and the CT scan for localization of the foreign bodies. We got the following results. At the presentation, the following clinical findings were noted. Vitreous hemorrhage was present in 19 eyes, that is 80% of the eyes showed vitreous hemorrhage. 75% showed hyphema or the 18 eyes. The retinal detachment was detected in 20 eyes, 83% cases, and endophthalmitis was diagnosed in 5 eyes or 20% of the cases. The same in the chart form. This is the case which showed the vitreous hemorrhage. The zone of injury was consistently found to be the posterior most, classified as the zone 3 in all the cases. The type of the injuries were categorized as the penetrating injuries in the 7 patients or type B and the perforating injury type D in the 17 patients. This was a patient whose one of the eye was eviscerated, who ultimately landed in endoff, and he was eviscerated, the left eye. But this patient showed retinal detachment with vitreous hemorrhage. In the management part, all the patients received management through the primary repair techniques, including localized lid laceration repair, vitrectomy surgeries, and intravitreal injections. The patients were monitored during an inpatient stay lasting between 10 to 15 days and followed up at intervals of 1 week, 1 month, and 3 months post-injury, and also 6 months. The primary repair was immediate surgical intervention was done. Inpatient stay was for the period of 10 to 15 days, and then they were followed up 1 week, 1 month, 3 months, and 6 months. These are the ocular trauma classification which I did. The open globe injury is classified. The trauma score. Moving on to the psychological impact and the multidisciplinary care. The many patients experience emotional distress due to sudden vision loss or impairment. This aspect emphasizes the importance of multidisciplinary care that includes psychological support alongside surgical management. The gunshot injuries to the eye pose considerable challenges in the terms of management and visual recovery. This study emphasizes the critical need for thorough clinical assessment and timely intervention to improve outcomes for affected individuals. Looking ahead, it is essential to foster the collaborations between ophthalmologists, trauma surgeons, and the mental health professions to provide comprehensive care. Thank you.
So in all you said you had how many eyes?
24 patients and 24 eyes.
So and you also said that gunshot, it is important the distance from which, so did you have any data about the distance from which they had sustained the gunshot, and was that kind of data available? Or how are these injuries different from other injuries that are sustained? Did you notice any difference between other mechanisms and gunshots specifically? Because gunshots I presume are fired with a, they will generate heat.
Yes, ma'am.
So maybe more sterile foreign body. Did you find foreign bodies were they sterile, but 5 patients
Yeah.
had endophthalmitis.
Yeah. Ma'am, some foreign bodies were seen in the 5 cases with intraocular foreign bodies like glass pieces and some bullets. Bullet was found in one case, which was operated in the neurosurgery department itself, and they referred then it to our department.
Yes, so I think that data could have come out, that how many foreign bodies were found, or what kind of foreign bodies
Yes,
were
ma'am.
found.
Yes,
in the
ma'am.
case.
Yes, ma'am.
And was it available? What distance the gunshot was? Did it make a difference to the prognosis or to the kind of injury they had sustained?
Distance I could not make that, ma'am, because
I
they
think once
didn't
we're
give the
talking
any
about gunshot,
relevant
we can see
history.
that the patient who had a closed lobe injury, did he have a different mechanism? Patient who had an open lobe
Okay.
injury, did he have a different mechanism of?
Yes, ma'am.
That would be
Yes, ma'am.
interesting.
Mm.
So this is 24 eyes you had.
Yes,
I
ma'am.
mean, this is over a period of what?
Uh, over a period of, ma'am, 1 year approx.
Over a period of 1 year.
Yes, ma'am.
This is from which state from India? Studied
From
India.
Ranchi, RIMS Ranchi, Jharkhand.
Okay. Thank you. Thank you very much.